Welcome to the Real Integrative Medicine podcast. I'm Dr. Jordan Robertson, and I'm here to bring you the tools, insights, and strategies to take your health to the next level while using evidence-based integrative medicine. What's real? This is what we want to explore together. Research is ever-changing and not easy to interpret. We're bringing you the best that integrative medicine has to offer while sticking to the facts. Our mission is to elevate the practice of integrative medicine for clinicians and patients alike. Preventative solutions, nutrition, exercise, and sometimes supplements have a seat at the table in medicine, but only if we uncover real science-backed solutions. It's time to uncover what works and challenge what doesn't. Let's unlock your full health potential with an integrated approach. Ready to learn what's real? Let's dive in. All right, welcome to another episode of the Real Integrative Medicine podcast. I'm coming to you from my home office in my living room with my very first little mini estrogen patch stuck to my tummy for my sleep. And I'm so excited to open up this conversation with my good friend, my colleague, one of the trusted doctors at my actual physical office in Ontario, Dr. Laurie Alpert. Laurie, I'm so excited to have you on this episode today and for us to dive in and talk about sleep in perimenopause.
Thank you so much for having me. I'm excited to be here too. And I'm excited to hear about your experience.
I know. And you know what? I was feeling like there was like a rite of passage, and I've used estrogen myself before for my menstrual migraines. And I definitely have this 4 or 5 day window where I get at least one migraine. It's like so crappy. And I, at one time, had been quite diligent about using a topical estrogen during that window. And it often would take the migraine away, or at least it would like push it a little later in my cycle, and it wasn't so bad. But I've noticed, and now I'm 43, that my last few months of cycles, I have night sweats during my period, and I'm waking up like, the way I describe it, and I'm so curious about what you're going to say here, is like, it feels like my brain has been plugged in. Like I wake up at 3 a.m. and I'm like, my brain has been plugged in, and I have not had coffee. I have not, right? And it is like this very different experience and feeling in my brain. And I've never struggled with my sleep in any other time in my life.
Yeah.
So this is the month where I decided to take radical responsibility for the hormone changes. And I am using a little small estrogen patch during this week, so that we'll see. I'll have to report back.
You will. Yeah.
But I'd love for you to start and share with our audience how this became such a passion project for you. Like why sleep? Why perimenopause and sleep? And how can we get this kind of conversation rolling today?
Yeah. Well, so I've been on this podcast before with you talking about mental health and perimenopause, and those are also two big areas of interest, and it goes hand in hand with sleep, right? Like we see this change in disturbance in sleep in perimenopause. So working in women's health, seeing these patterns reappear over and over and over again, and recognizing that sleep disturbances just make everything else worse and harder, including mental health. We know this bidirectional relationship occurs between, depression, anxiety. You're more susceptible to sleep disturbances, and the opposite is true. If your sleep is disturbed, you're more susceptible to mood disturbances. So it's just also closely interrelated. And seeing how little value culturally we put on sleep and rest and recovery has always kind of blown my mind, because it's just so essential. And when that's out of whack, everything else is harder. So if people are coming in with weight concerns, low libido, low mood, like all the classic stuff that shows up around perimenopause, and then they're not sleeping well, it's hard to tackle any of those. So it's just been, a repetitive kind of foundational part of my approach to care at this life stage.
And so for our listeners who maybe this is a new conversation for them, that didn't realize that there was such a big connection between sleep and their hormones in 40s and 50s, like what is actually happening there, and why does perimenopause interrupt sleep?
It's such a great question. So we see that, the range of reports is like anywhere from 30 to 80% of people in perimenopause report sleep disturbances. Now, this overlaps with aging, and we see sleep disturbances and changes to our sleep and our melatonin production that happen with aging. But we also see that as a result of decreased production of some of our ovarian hormones like estrogen and progesterone. We also experience this fluctuation of hormone production through perimenopause, and both those ovarian hormones have been shown to impact multiple sleep wake centers in our brain. So as those fluctuate and as those decrease, we start to see some other disturbances as well in our sleep. And it's not always clear or obvious that it's hormones at play, especially earlier on. And sleep disruptions are one of the earlier symptoms that people tend to report, even before they start to see cycle changes. So it's not always obvious that that's what's happening. But yeah, it's some of those, the declines and the impacts that the hormones can have on our brains and our nervous system. There's so many levels that it's at play. I could probably spend the whole hour answering that question, but I'll stop there.
Yeah. And I think, I have this like luxury of going through perimenopause, being like highly educated. And I like truthfully don't actually fit the diagnostic criteria for being perimenopausal. Like my cycles are very regular. But during that 5-day window, I have night sweats. I have not really hot flashes, but it's like the night sweats and then the sleep disturbance and the migraines. So I know that it's hormone related, but I think if I didn't, right, I would maybe just be like, ew, I'm sweaty because I have my period, or, oh gosh, I have no idea, but every once in a while I have this terrible sleep. It's only because my knowledge is so high that I can see the connection between all three of those things that are happening together. But it wouldn't be impossible for us to brush off the sleep part if you weren't experiencing the night sweats or whatnot, and not see the link between those changing hormones and the quality of sleep that you're getting.
Absolutely. And it's so common too, because we have disturbed sleep for lots of reasons, right? It's not just hormones, and it doesn't only happen at this life phase. So there are other things that can occur, whether it's job stressors or the age of your children, if they're young, teens, college age, whatever, that can all impact sleep. And then that anxiety, you asked me what I would say to that, like being plugged in before. At this specific stage, because it's people report it so commonly, I almost feel like it's a hot flash of the nervous system. Like our understanding of the way hormones impact our nervous system, and that really the hot flashes are more of a central nervous system issue than like a sweating issue. It's similar to that being plugged in feeling. And so that waking up in the night, people could easily attribute to, I'm just anxious, or I have a presentation, or what have you. But sometimes people will say, I wake up and there's no reason to be awake. I'm not stressed. I'm not, there's nothing going on. And especially if they can track those patterns where they can see that happening a little bit, earlier, right before their period, or if it's sort of cyclical, it happens every few weeks, but then we have weeks where we sleep through the night better. Those are some of those earlier clues that it could be hormonal related.
So I think we can probably all agree that the like sort of magic bullet approach to sleep, which would be like, here, take this pill and go unconscious for 8 hours and we'll see you in the morning, is not ideal, right? Like on every level, those medications can sometimes carry with them risk of addiction. They certainly can have the risk of, the grogginess or not really feeling like yourself in the morning. And they're also not really getting at the root of it. So what we often will find with those sleep medications is that they work for a period of time and then things kind of wear off and people end up sort of back where they were. We do need an integrative approach to sleep. What does that even mean to you? Like when I say like, what is an integrative approach to sleep? Like what are those pillars that are impacting someone's ability to sleep well?
Really good question. I'm going to answer it on two levels. So I think on a big macro level, we're talking about what are the things that we have to consider if someone's struggling with sleep. And so we're considering everything we understand about chronic insomnia and sleep. So where the science sits just in sleep in general. In perimenopause, we're thinking about what are the impacts of the changes to hormones on our sleep and different things that might impact our sleep, like the vasomotor symptoms, in addition to sleep independently. And we're also thinking about just the changes that occur as we age, because we do see shifts to our sleep architecture as we age. And then when we get into the macro level, an integrative approach really to me means we're pulling in all the ingredients. So we've got behavioral strategies, which, for the record, is first line for pretty much every sleep disturbances. There are a few exceptions and we have to be careful in some cases, but things like CBTI, cognitive behavioral therapy for insomnia, for the majority of sleep disruptions, that's still first line in most effective and safest strategy. So these behavioral foundations are really important. I do think pharmacology has a role to play. We have to consider, safety concerns, but sometimes the pharmacology is really helpful while we're implementing those behavioral strategies. And sometimes if you've had chronic insomnia, like you're desperate for sleep and you can't make change until you get a little bit of that relief. And pharmacology could look like those sleep pills. It could look like hormone therapy. It could look like an antidepressant. Like there are so many approaches to consider that an integrative approach is really going to take a good case and find out what is the root of your sleep disturbance, so that we know how to best support you. And then we could think of supplements and some other things like, a CPAP, for example. If there's sleep apnea, it's not pharmacology, but we have to think of the role that's playing. But when it comes to supplements, I like to call it sort of the spice of the meal. Like you're not going to get, for some people, maybe with light disruptions and we use supplements, you're unlikely to get full resolution of what you want. It's like we're going to sprinkle on the spices. The real meat of the meal is going to be those behavioral things that we need to do. And it's not always as scary as people think. Like they're usually very subtle, and so incredibly impactful. But if we just have the meat, maybe we need some of that pharmacology. Maybe we need some of the spices of the supplements in the meantime to make it a really well-rounded, integrative approach to get people feeling their best.
Yeah, I love that you brought that up about the pharmacology, right? I think that sometimes people need to be feeling a little bit better before they can work on feeling better, especially if the thing we're asking them to do requires some bandwidth and some, gusto. And when you're feeling your worst, then it's, not usually the time that you are ready to take make radical changes to what's going on
Yeah.
in your day to day. So I appreciate that you brought that up, because I think, I always say like we would probably want to work towards a solution that maybe doesn't involve sleeping pills per se,
Mm-hmm.
but getting to that point where you even can think about solutions may require that, right, in the short term
Yeah.
for someone.
Yeah, absolutely. Yeah. And there's especially in our field, I think there can be a resistance because we've heard all about the habit forming nature of some of the meds. And even amongst prescribers, I think it's changing a little bit, but there are medications that have a much better safety profile that can be considered for longer term and can be used to get people over that speed bump so that they can implement those things.
I don't know if this is you or not, but if you're a naturopathic doctor or an integrative practitioner who prides yourself on being evidence-based, but don't have time to stay up to date with the research yourself, I have a solution for you. I'd love to invite you to explore and join the Confident Clinician, the only integrative medicine clinical decision-making tool that helps get research from PubMed into your practice with ease. We have built out exactly what you need to be the most efficient in your work, to be the best in your community, and to save you those precious hours that you're spending right now doing the research yourself. Joining with our premium membership gives you access to unlimited AI searches, gives you access to all of our previous database content, as well as our upcoming year of live delivered modules. You can check out more in the link in the show notes. I would love to see you inside of our community. We're making a huge difference in the way that practitioners practice integrative care and raising the bar for evidence-based integrative medicine. I hope you'll join us.
I'd love for you to shed some light on some of those behavior strategies. And,
Mm-hmm.
I think when people are really struggling or suffering, right, and we come at them with a strategy that feels like a small little habit change, it's easy to dismiss how efficacious that little habit change might be, right? And I've even maybe experienced that in my own journey, where it's like, I have sore muscles and people are like, stretch. I'm like, yeah, okay, stretch. Right. Like, cause I'm like, of course that's not going to like get into the level and depth of support that
Mm-hmm.
I need. And yet when we talk about some of those sleep habits, like they feel like these silly little things that we would recommend to like a 10-year-old who is having trouble sleeping. And I think sometimes as adults, we can maybe find some of those recommendations like, lame or silly because they seem so like they're not going to make a dent in someone's like significant sleep issues. what does the research say like about some of that habit change and how to build better sleep habits?
Well, like I said, it's first line a lot of the time. So it does kind of sound lame or feel silly. So I can totally understand that. And I've been on the receiving end of it. And it's hard sometimes to implement because like, I don't wanna. It's that feeling, right? But all of the research supports that those are the safest and the most effective and longest lasting, right? Having the longest impact to promote consistent quality sleep. So I like to remind people, especially if you've had the experience of having children and having to put them to bed, like there's a very specific bedtime routine. You're like training, priming your body. And I think we forget that we need the same thing as adults. And I'll hear a lot of times from people, oh, I do all the sleep hygiene stuff. And like,
Mm-hmm.
cool, great. If you're doing it all, amazing. You're that much farther ahead. And that means we have some other things to look at. And let's make sure you really are doing all the sleep hygiene things. One of the things I find really incredible is, and we often don't think about, is like how we start our day is so impactful to our sleep. So we're often thinking about that bedtime routine, or am I using screens at night in bed, or, am I working on my computer in bed before I go to bed, or what are the things? But I like to start with the morning and when we wake up. And the research shows like consistent wake times to be very, very effective. And that's harder to achieve, when we have inconsistent sleep because we don't want to get ourselves up earlier than we have to. But I think the trick is it's like short-term pain for long-term gain and some of the sleep strategies. And so it's to your point. It's like just give me like a week or two and stick with this and then watch what happens. And it can be really tremendous, but it can be hard to convince sometimes.
Totally. Yeah, I can see that. And even I'm glad that you brought up that like checking that you're actually doing it. And I think that, and I remember working with patients and they would say the same thing. Oh, I'm doing all the sleep hygiene, right? And it's almost like the same thing where we say like, oh no, I'm eating really healthy. And then we're like,
Mm-hmm.
but are you?
Mm-hmm.
And when we really dig in on some of those details, it's like, we've often like really made a lot of excuses for why we have some of those habits around our sleep that we do. Well, I have to keep my phone here because of this. Well, I have to work at night because of this. Well, I have to stay up until 11:30 because of this. Well, I have to
Mm-hmm.
like, and it's so interesting because we can like say out of one side of our mouth that we want better sleep, and then out of the other side of our mouth come like 12 excuses for why we can't do the things that have been shown to improve our sleep.
Totally. Yeah. That happens all the time. Yeah. And I think sometimes it's like, well, I've always done this and it's never been a problem. And so it's really hard to see that that's maybe part of the problem. And, the response to that is, well, something needs to change. Like you're doing it and you're having a problem. So maybe that is the issue now. Like, I think that's one of the biggest pieces I see in the shift around perimenopause. And like we were talking before, it's similar in some ways to like weight management or libido. It's like things that worked in the past no longer work the same way. And it's the same with sleep and some of our strategies. And so things that we used to be able to get away with, like less sleep hygiene or less intention around sleep didn't seem to be a problem. But now that's different. And so our approach needs to change.
Mm-hmm. I think that there's a really important distinction there, what you just said, right? Like there's a difference between saying the things I used to do were never a problem. And
Mm-hmm.
then there's the things I used to do. I just lost it. It's that idea that like you used to be able to get away with it,
Yeah.
right? Like you weren't doing things intentionally to improve your sleep
Right.
before, right? It's not
Right.
like you were. I had this amazing sleep solution, and now that sleep solution no longer works. It was you were doing things that you could get away with
Yeah.
because hormonally or resiliency wise or life stage wise, they didn't create a symptom.
Mm-hmm.
But now those same things do. And
Mm-hmm.
so it's not that you were doing amazing before, you just
Mm-hmm.
didn't experience anything bad from what you were doing before.
Yeah, that's a really good point to put it that way. And I've had patients with, more severe chronic sleep disturbances and they're kind of working their way through the recovery, like in collaborative care with myself and their GP or whatever other specialists. And sometimes they're like resentful of the consistency or how sort of seriously they need to take it in order to achieve that quality sleep. And I can understand that. It's a little bit of like resistance of like, oh, now my body needs me to do that. Like it was so much easier and I had so much more fun at a different stage of life. And we can sit in that place for a little bit, but ultimately hanging on to that is not going to help us, right? At some point, we've just got to say, okay, this is what my body's asking for. And if I want, results A, then I have to do B to make it happen, or else, because otherwise it's not happening anymore.
Mm-hmm. And I'm curious, like, and I think because we're so willing to discount like how we feel, right? Like our quality of life and our quality of our day, sometimes we place so little emphasis on that when things are just mediocre. We just kind of go through mediocrity with a lot without actually striving for more. But I'm so curious on that like return on investment trade. If you have a 45-minute bedtime routine and that feels annoying, but if you don't sleep, have you lost more than 45 minutes worth of awesomeness the following day, right? It's like you're eating and sleeping today to prepare for tomorrow, not to recover from yesterday. And if we can think about it in that, like, how do I set myself up for the best for tomorrow? My guess is that when people are tired, they lose more than 45 minutes of themselves the following day, right?
Yeah, it's a really good point. I really like thinking about it that way. It's like, what are we going to get out of this versus what's the cost of this to me? I think you've talked about that a lot in lots of other different ways. I like that flip.
And what is the sleep hygiene? I know you mentioned like the consistent wake up time, but
Mm-hmm.
what is the most detrimental bedtime habit that we think right now, like based on the research? Like, what is the thing that's just like it's like a do not pass go? This is ruining your sleep.
Well, I don't know if you're like fishing here for something.
Just don't say the things that I do because I don't want to hear it.
I mean, I guess like the one that comes up a lot, but if it's debated, would be screens in bed, scrolling through the phone, the doom scrolling, that kind of thing. Like a lot of people talk about that. There's so many, right? Like drinking before bed, alcohol intake, like eating heavy foods before bed. There's a lot of things that can be detrimental. So it's hard to pick what the worst is, Jordan. But I'm thinking of the screens piece. And the funny thing that I find, like probably when I was doing this work younger, I was a little bit more dogmatic about some of these things, right? And phones weren't as pervasive as they are now, so it was like kind of easier to say just get a regular alarm clock and leave your phone out of the bedroom. But you have to kind of come to a middle ground because phones are people's alarms. People have teenagers who are out late. They want to be reached. Like I know we can make excuses, but also there's realities to having some of these devices in our bedrooms. And the research actually, there's not a ton of research on it for this demographic. So the research looking at screen use is in pretty much the oldest people go maybe in the research is 30, like it's in adolescents and young 20-year-olds. So we're extracting a lot from that. And we're looking most like, how much do the light cues impact your sleep cycle and your circadian rhythm, but also what is the content doing? And I think that's an important distinction too, especially in perimenopause, because I would argue more than the light from your phone at night, if you're someone who's scrolling in bed, is the content you're consuming and how that's leaving you feeling before bed. So, is it calming or does it create anxiety? Do you have comparisitis when you're looking at people and then you feel worse about yourself and you're trying to go to sleep because I'm ruminating about that? Or, are you like doing something that brings you joy? And so moving away from being more dogmatic, it's like, okay, let's just kind of look at the role it's playing and how it might be impacting you and experimenting with different things to see. But again, that's just going to be one piece of the whole picture. Like, I don't think anyone's going to have a revolutionary sleep shift in perimenopause if all they do is like turn their phone off 10 minutes earlier. Like it's this mix between there are some really subtle things that can make a difference, but also we want to hit it from all the sides with these subtle things. Does that make sense?
Absolutely. Yeah. And I think it's such a great point that like the intentionality around some of those pieces I think is equally as important. I'm so curious because if we take someone's like phone time away before bed, it's a drop in the bucket for their total screen time for the
Yeah.
day, right? I'm
Yeah.
like, I always feel so, appalled when I get my like screen time reports at the end of the week, right? And it's like, you were on your phone for
Nobody
and
wants to see that.
like 1 billion hours this week. And
Mhm.
so I'm always curious about that, right? Like, because it's not just that, from sundown to bedtime that we're looking
Mhm.
at screens. We're actually looking at screens all day on our
Mhm.
computers too. So, but I think you're right, like around the intentionality around the content that you were consuming. I set up some alert or like the sleepy time mode on my phone. And
Mhm.
what I've noticed about myself is that there are certain apps that I just go like, ignore, ignore, ignore. And then it's like the same 3 apps that I've ignored the sleepy time on. And those are the ones that probably I shouldn't be on before bed, right? It's like I'm
Mm.
never looking at my calendar before bed or how many, PC optimum points I have before bed. I'm only looking at social media or LinkedIn or,
Right.
going and looking something up on online.
Mhm.
And then those are the very things that like probably are not creating sort of that like positive, peaceful time before bed.
Mhm. Mhm. Yeah. It's all the things coming down at once in this life stage too, because there's just so much that we're trying to manage and keep in mind. And so, yeah, you're probably, checking your email one more time and then shoot, did you really need to see that right before you try to go into bed? That's not helpful. It's a challenge for a lot of people and totally relatable. So I think it's hard sometimes to do like a blanket recommendation, like everyone leave your phone out of your bedroom because it's not always realistic. So it's sometimes helpful to just, I'm not going to say nitpick, but like find the thing that feels achievable for you in that moment and like chip away at it, right? Like if it's just block that app, like what you just reported is such a great example of figuring it out and what are the things that I'm drawn to and then how is it leaving me feeling before bed and what kinds of things or accountability can I ask people around me to help me with so that those are not the things. And maybe I do need to leave my phone outside of the bedroom or have like my spouse have the code after a certain time or whatever it is and just see how that goes because sometimes it's hard to do it all by yourself too.
Yeah, because it's like it doesn't feel in the moment like it's making that big
Yeah.
of a deal, right? But the
Yeah.
accumulation of it probably over time, or at least it's like
Totally.
one more drop in the bucket of the
Yeah.
perimenopausal sleep.
Yeah.
Tell me, Laurie, what are you noticing
Mhm.
in terms of like prescribing trends around HRT for sleep? Because I still think, despite all of the big discussions online, we
Mhm.
still maybe see a gap in using HRT for that indication specifically. But what do we know about using hormone
Yeah.
therapy for sleep? And then what are you noticing about what people are achieving when they have this conversation with their doctor?
So I love the research on the hormone therapy and sleep. I just find it so interesting. And so we see benefits from combined therapy and from progesterone alone. And the difficulty of studying like is the benefit from estrogen or is it from progesterone or the progestin, as we've known for a long time that it's not really safe to give estrogen by itself. So it's always coupled. So it's difficult to know how much is the estrogen versus the progesterone. That said, there are some comparative studies, and we do see benefits from estrogen therapy or combined therapy that extend beyond the benefits to vasomotor symptoms, right? So, hormone therapy on label is used to treat hot flashes or night sweats, which are called vasomotor symptoms, or prevent osteoporosis, or for, sort of low ovarian hormone conditions, or GSM, so more vaginal local therapies. But if you don't have, hot flashes, it's very common to just be dismissed and for it to not be prescribed. And even for some people with hot flashes, if they're not yet menopausal and their prescriber is not up to date on the research, they might be denied the hormone therapy. So, one option is to give the combined hormone therapy, especially when hot flashes or night sweats or different, some of that nighttime waking or nighttime urination is waking you up at night. The combined therapy can help. But progesterone by itself also can be beneficial. And I know there's a lot of talk about like, do we give progesterone alone? Is it safe to give by itself? Does it have to be combined? What about progestins? And the research does show that micronized progesterone has a stronger effect on sleep as compared to progestins. And for listeners, progestins are just synthetic forms, different versions of a progestogen. And so the oral forms of progesterone have been shown to help sleep independently because we can give those by itself. So we do have studies looking at that by itself to help with sleep. And sometimes that's recommended earlier on in perimenopause if people are not having significant hot flashes, because progesterone on its own can resolve mild hot flashes as well. So it's a nice introductory hormone for people when it's safe and appropriate. But that said, there may be other reasons to use combined therapy. I really see a benefit. It depends on the person if they're going to just, get enough benefit from progesterone or if they would need the combined therapy, because both hormones can play a role in sleep disturbances. And clinically, I find sometimes it's a little bit of like, we have to try and see. Maybe you need both. Maybe one is more effective for sleep than other for you. But what am I seeing in practice is the same issue that we've been talking about in perimenopause and menopause, like across the board, is just a resistance to prescribe and people who are not as up to date on the research. So the outcomes of the Women's Health Initiative, the sad state of menopause not being a part of medical education to the degree that it should have been, and people being denied a potential beneficial therapy because of some of those residual effects. And it's difficult too because it's a bit of an off-label use, right? Like hormone therapy yet has not been approved specifically just for sleep disturbances or perimenopausal sleep disturbances. So you need someone who understands that research and is willing to go there with you.
It's funny, even as I was like opening my little estrogen patch box, the instructions, right? Like I like opened it up like
Oh my gosh,
a
yeah.
massive old newspaper, right? It was like filling my kitchen, this little insert that comes with it. And the section on like how to put on your little patch is about this big, right? And it's like maybe 3 inches of text, like peel off the back, stick it to your tummy, have a nice day. The rest of the insert was basically telling me that I was going to die. And it's interesting because I used to warn patients and say, look, the insert is incredibly outdated. It's talking about medications we no longer use, right? Like it's the instructions for medications we don't use, but it's going to be with this medication that you're about to be prescribed. And I still was so shocked at how fear-mongering the leaflet for the very medication actually was by regulation. Like I'm sure the company wishes, and hopes and dreams that they could remove these information from the leaflet as well. But there's still that undertone of fear and that undertone of risk, even when we're talking about like this, really well-researched medication. It has a backpack of baggage from years of misinformation that's still being delivered with it.
Yeah. And then if you sort of like put that side by side with the potential benefits to getting a good night's sleep, like it's like this, it's unreal. It's just so, the discrepancy is so huge. So we undervalue quality sleep and we're scared of women's hormones. Like those two things don't go well together.
Although then if you also go like read some like Substack articles on sleep, it'll be like, if you don't sleep, you're going to die.
Yeah.
And then you open your estrogen patch and it's like, yeah, but if you use this, you also will die. So.
It's true. It's true. Oh, it's so hard.
One follow-up question to the HRT I wanted to ask you, Laurie, is like, how long should patients take their medication before they expect to see benefit? And one of the things, and I'm saying this because this was a frustration of mine, is that people can sleep poorly for lots of reasons. And HRT is not a silver bullet. Sometimes we get lucky, right? And people will take that first dose of progesterone and they're like, I'm cured. This is the most amazing thing ever. But what I would notice is that even if that did happen, that then over the course of, say, a month, people would still have 1, 2, 3 nights that were not awesome. But their expectation was that their hormone therapy was going to act like sleeping medication and just fix it indefinitely forever and always.
Yeah.
And that was always so hard to discuss, like in terms of like how to understand the expectations around sleep and how tolerant I might be as a clinician for 1 or 2 bad nights every once in a while, but how intolerant the patient was to that same level of sleep.
Yeah, I see that a lot as well, Jordan. And even that like initial response being really positive, but it kind of wears off a little bit. And that's why I like to I sort of set the stage with people that we're looking at it. We're treating your sleep from all three pillars I mentioned before. So we're going to take the approaches that we know help insomnia, like from the sleep research, independent of this life stage. And we're also layering in what we understand about hormones. And we also need to consider what are the things that happen with aging. So, and it's sometimes the aging and hormones thing, like you can't always tease it out. They go together because it's, we have to reach a certain age to reach menopause. And that's different for different people. But so it's never just like one leg of the stool is going to be the magic bullet. So we need all three parts of the stool to really give you longer lasting quality resolution. And sometimes it's not a total, you're not going to expect to sleep like your 5-year-old who passes out drooling in the middle of a party if they're tired enough. We have to understand that our sleep architecture does change, and so we may wake up a little bit in the night, but can we fall back asleep, and how do we feel in the day the next day? So coming to terms with some of those shifts too, I think, is important. So setting those expectations up from the get-go is huge. And it's to your point before, where people can read on Substacks that you're going to die if you don't sleep this amount every single day, and that sort of thing. We know sleep is beneficial. We know that chronic sleep disturbances can have some negative health outcomes, and also we know our sleep evolves, and like we're going to be okay, right? So it's finding that sweet spot. But yeah, I think to answer your question, we do have to set that expectation that the meat of the therapy will include some of that behavioral change. And so these are sometimes tools to help you establish and reaffirm those for yourself.
Mm-hmm. And I don't know if there's any research on this, but I always wondered if like the level of like frustration and resentment and then fear about getting into bed and then blaming all the things and all the people and all the cats and all the husbands and all the things about your sleep, if that actually worsens sleep, right? Like this is something I
Oh
would love to
yeah.
know, if because I would struggle so much in that dynamic
Yeah.
sometimes clinically, where people would be so angry that their treatment hadn't worked, and I'm like, but it's the anger part of it, right?
Yeah. Well, that's actually part of CBTI, is like understanding our negative, beliefs and ideas about sleep, and really getting to educate yourself around what the expectations are. And then there are people who have created such a, whether it's their past experiences, where they now have like more anxiety around going to bed for fear of not being able to fall asleep, that there are different strategies to approach someone like that. So yeah, I think it's probably more common than we think. And that's another piece of the puzzle that we have to talk about and think about and approach with care, because it certainly can make things harder.
Tell us about, so I know you've created an amazing resource for people to be supported with sleep and actually walk them through how they can take, we'll call it radical responsibility for their sleep
Yeah.
in perimenopause. Can you share with our listeners what you've been working on and what that project looks like and how they can get a hold of it?
Yeah, absolutely. So I've designed an 8-week experience to try to help you transform your sleep, especially through this perimenopause life stage. It's, partly educational and partly activity based and behavioral change strategy, with some accountability and lots of tools to help you know exactly what to do when, and keep you on track. And it is through this lens of what do we need to know about body changes and hormone changes and how that's impacting our sleep? What do we need to know about the changes as we age, and what sort of things might be coming into play that we hadn't thought about before? And, how do I implement what the science suggests is the most effective treatment to resolve my sleep challenges? So it's called the Perimenopause Sleep Solution, and I package it all up together to kind of hold your hand through that transformation, and let you know, if any of these pillars are missing some support, who do you need to talk to while you carry this out so that you can get the best outcomes for your sleep. Because like I said, I'm a sleeper who entered perimenopause and had lots of trouble with my sleep before I knew what was going on. because like you didn't follow the same pattern and so had the same kind of cycle regularity. And it's so foundational to everything. Like everything is better when you're sleeping better, or you at least have the tools to know what you need so that you can make a conscious decision. I know if I have some wine, which I have very rarely these days, that it's going to impact my sleep. So I make the decision. If I'm going to have it, I know what kind of decision I'm making, but at least I've had the experience to know that. And if I go through like an event, or I'm traveling, or I get sick and something throws off my sleep and I find myself in a state of like acute disruption, I know now the tools and the patterns and the things that I have to put back into place to get back to regular quality sleep. So that was the goal of my course, is to equip people, guide you through, but also leave you with the tools and understanding of what you can do for those times when your sleep is disrupted again, because I can't promise, baby quality sleep for the rest of your life. I would love to, but I can't.
I would like that. I know when I watch my teenagers sleep, I'm just like, oh.
I know.
And it's so funny when you I don't know if this happens in your house, but like when everyone wakes up, all you do is just ask them about their sleep, right? And I've seen so many memes about that. And it's like getting married is basically just asking someone how their sleep was every morning for the rest of life, right? And it's like, how is your sleep? And, my husband and I have had our various sleep challenges, we'll call it, over the last little while. And so we're always trading stories like, oh, yeah, I heard you get up, or, oh, yeah, you did go to the bathroom 3 times. But then the kid, right? Or the kids, I'm like, how'd you sleep? They're like, great.
Yeah, they're probably thinking, why do you keep asking me? I sleep fine every night.
It was fine until you woke me up, because I would have kept going.
Exactly. Yeah, I know. It would be nice, but yeah.
It would be.
Yeah.
Well, we'll put the links to all of that in the show notes for those of you that are listening. I'm such an advocate of people, if you're a self-starter, right? Like there are so many ways now that you can be a self-starter in areas of your health, and courses like this that Laurie has put together is a really great example of how you can take charge and actually be the authority and an agent of change in your own health journey. So we'll put the links to all of that in the show notes. But we're real big fans of what you've put together there for our listeners. So thank you so much for that. And thanks for this chat. Like, I think it's been it's nice to refresh on this topic, and then to even make that link between the last episode we did together on mental health.
Mm-hmm.
Because I think, we often will think about these things in such silos, right? And it's not until they show up on our doorstep as a problem do we pay attention or acknowledge them. But this perimenopause journey for people, like everything shows up on their doorstep all at once, and things that they've never had to deal with. And
Yeah.
I think conversations like this can help bridge that gap and give the level of knowledge people need so they know what to do.
Yeah. Well, thanks for creating a space where they can happen, Jordan.
Amazing.
Awesome.
Thanks so much, Laurie. And we'll put the links to follow Laurie on Instagram and online as well in the show notes. Thanks for another awesome conversation.
Thank you.
That's it for today's episode of the Real Integrative Medicine podcast. I hope you're feeling inspired, informed, and ready to make changes that truly support your health. If you found value in today's discussion, don't forget to hit subscribe, share this episode with someone who needs it, and leave a review. It helps us reach even more listeners just like you. Your health journey is personal and it's powerful. Let's keep building on the knowledge to give you the confidence you need to thrive. It's important to remember that the Real Integrative Medicine podcast is for educational purposes only. Be sure to talk to your doctor before making any personal health changes. This podcast isn't intended to diagnose you, and no doctor-patient relationship was formed by listening. We'll see you next week.